Hello, I'm Dr. Lester Hartman from Westwood-Mansfield Pediatrics. Today we're going to talk about how to get your child, your teenager, to comply with taking their medications. This is for Westwood-Mansfield pediatric patients only. If you're from another practice, you may want to discuss this with your pediatrician who may have a different opinion. Getting teenagers to take their medicines regularly can be a bit of a challenge at times. Sometimes parents make errors such as, I'm going to make them responsible when they're 13. It should be a mutual sharing of responsibility, not completely turned over to the child. Because if you don't monitor, oftentimes kids at this age won't comply with their medications for many reasons. One is the frontal lobe has not been fully developed in judgment. Oftentimes that can take a number of years. And the expectation for them to be consistent with medicines, especially those that are twice a day, which are usually your acne medicines and your asthma medicines. They oftentimes will miss at least one dose each day because it's out of a routine sometimes. So when I see parents with kids, for example for acne, and the teenager has not been taking their medicines, and parents are ones pushing for the kids to take their medicine, we must keep in mind that if the child is not convinced they want the medications, or they care about improving their acne, it will be a challenge for them to comply. So parents need to reflect on that a moment before trying to make kids use acne medicines. Now, if it's severe acne and the kids are not responding and wanting to take medications, occasionally some of these kids can be depressed, and that can be a marker, severe acne and not wanting to do anything about it. And we need to think of that as well. Oftentimes when I talk to kids about why they aren't taking their medicines, and they do want to take these medicines, it's for many reasons. One, where's the medicine located? Two, is the parent helping out with them to remind them to take their medications? Three, are there any side effects that they don't like that we need to change the medicine so that they'll continue to take it? And four, it is difficult on Friday and Saturday nights during the school year to be consistent about taking evening doses of medications. As well as, excuse me, sorry about that, it's the spring now, as well as when the summer comes and that transition happens and they're out of routine, I'm sorry, they may lose their ability to take their medicines. And the routine needs to continue on. It just has to be, you have to regroup. Oftentimes the best place to leave medicines is on the kitchen table. Your antibiotics, tetracyclines, minicin, things like this, amoxicillin for acne are best you put there. Sometimes the creams are best put upstairs in their bathroom, in a place that they can see it all the time, not hidden in a medicine chest, number one. Number two, you should have a chart with a checkoff system so that the kids, when they do it, it's checked off and you monitor that chart as well. Sometimes in the morning kids are rushed to get out, so they don't take their medicines. Or sometimes at night they come in late and they forget to take their medicines. So you can check the chart every day to make sure that they're taking their medicines. And it's important also for you maybe to remind them. Again, the breakfast table is often a good place to put things if they sit down and have breakfast, or even if they're rushing out the door and they pick up something on the breakfast table. Sometimes by the bedside and sometimes in the bathroom. But I ask the teenager, why haven't you been able to take your medicines? What is it about this that makes it difficult for you? And they can problem solve themselves. And oftentimes if they problem solve themselves, they will comply. If they don't comply, then sometimes it's that they're just not interested in taking the medications. And sometimes we have to sit back and say, okay, for now we'll back off. Classic example is the 13-year-old male who could care less about their acne. When they turn 16, and they're interested in girls, it's a different story. Then they want their acne fixed yesterday. So and then when prom time comes as well, it's a key time. So keep in mind, and this is true with asthma medicines as well, morning and night meds sometimes the morning can be difficult for some kids, sometimes the night can. And it's important to explore with your teen and to work mutually with them for them to continue to comply with taking their medications. This is Dr. Lester Hartman from Westwood-Mansfield Pediatrics, proactive in your child's care, empowering families for over 50 years. Thank you very much and have a nice day.